Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, and the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe and Dr. Shahab will have opening remarks, followed by time for questions.
Well, thank you very much. And I think if they're not joined, they'll be joined here right away, Dr. Shahab and Scott Livingstone. But good afternoon, everyone, and thank you for joining us here today. We have a lot of ground to cover here today, so my remarks might be just slightly longer than they normally are. The pace of Saskatchewan's vaccination rollout continues to lead the country. We have now administered more than 460,000 doses, or 460,000 vaccine shots, and 415,000 of those vaccine shots have been residents that have received their first dose. That's 44% of Saskatchewan adults who have now received their first vaccine dose. That pace is going to increase even more as we get into May. We expect to receive in May at least 367,000 more vaccines, and those vaccines will continue to go into Saskatchewan people's arms as quickly as we receive them. As of today, everyone aged 37 and older, as well as a number of frontline priority workers, are eligible to receive their first shot at a clinic in this province. In the far north, every adult aged 18 and older is now eligible to also receive their first vaccine dose. As we receive more vaccines, we will continue to lower the age eligibility throughout the province until that eligibility is open to everyone, sometime in mid to later May. For weeks now, we've been saying that the road back to normal runs through one of our vaccination clinics, and I want to thank the thousands of healthcare workers and now pharmacists who have been delivering those vaccines each and every day. I want to also thank the hundreds of thousands of Saskatchewan residents who have gone to one of those clinics to receive their vaccine. They've rolled up their sleeve, they've gotten vaccinated, and as more of us get vaccinated, our province becomes a safer place. And we can get back to doing more of the things that we have missed out on over the past year. So today I want to provide to Saskatchewan people a very clear roadmap of how we are going to achieve this, and some important markers along the way. Saskatchewan's reopening roadmap is a three-step plan to gradually lift the current public health orders as Saskatchewan reaches significant vaccination levels. Step one will occur once vaccine eligibility is open to all adults province-wide, and 3 weeks after 70% of those residents 40 and older have received their first dose. Step two will begin 3 weeks after 70% of people aged 30 and older have received their first dose, and 3 weeks have passed since step one started. Step three will occur 3 weeks after 70% of all adults over 18 in the province have received their first dose, and 3 weeks have passed since step two has begun. So in step one, household bubbles can expand to 10 people, public indoor gatherings can be up to 30 people, and public outdoor gatherings up to 150 people. Restaurants can have 6 at a table with physical distancing between those tables. Places of worship can have 150 people or 30% of capacity, whichever is less, with physical distancing between those households. Intense group fitness classes can resume at gyms and fitness centers, and the current province-wide masking mandate will continue to remain in place. In step two, private indoor gatherings, including household gatherings, can be increased to 15 people. Public indoor gatherings and private and public outdoor gatherings will be 150 people. And the 150 person limit will also apply to our event facilities and as well casinos and bingo halls. Theaters, art galleries, libraries and recreational facilities as well will be covered by the 150 person limit. There will be no capacity limits in step two on retail and personal care services, but they must maintain an occupancy that allows for physical distancing. There will be no table size limits on restaurants, but they must maintain 2 meters between their tables or physical distancing. And dance floors and buffets will, however, remain closed through step two. Also in step two, all remaining restrictions on youth and adult sports will be lifted. In step three, most remaining restrictions will be lifted. Guidance on gathering sizes and indoor masking policy will be developed in the weeks ahead based on the progress that we see in the first two steps. Public health orders from Step 2 on gathering sizes and indoor masking will remain in place until that guidance is finalized. Based on the current rate of vaccinations, the province should enter Step 1 sometime in the last week of May. Step 2, likely in about the third week of June. And Step 3 will be in early to mid-July. I know that some will say that we are moving too slow on this reopening roadmap, while others will say that we maybe are moving too fast. And to those who would like us to go faster, I would say that we do need to be cautious. While our case numbers and our hospitalizations have been stable or even declining slightly over the course of the past few weeks, both down about 20% from their peak in April, we do need to wait just a few more weeks so that more people are able to access their vaccine before we start lifting current restrictions. To those that may say we are going too fast, I would point to other countries who are further ahead of us in vaccinations and have been safely and successfully moving through their reopening plans, which are very close to what we have here today. In particular, I would point to the United Kingdom, who will soon be moving into Step 3 of their reopening plan. They expect to lift all remaining public health orders by June the 21st. The UK began Step 1 of its reopening on March the 8th, and on that day, they had 43% of their adult population had received their first dose of the vaccine. That's roughly where we are here today, with 44% of Saskatchewan people having received one vaccine dose. Case numbers and hospitalizations have continued to decline in the UK as they have carefully moved through the stages of their reopening plan. And I believe we can do the same here. But it's going to depend on more people getting vaccinated when it's your turn. So just to be clear, we are not stopping or in any way slowing down our vaccination plan once we reach the various thresholds that we have put forward as we start moving through these three steps that are before us. If anything, our vaccination plan is going to increase in its pace in the weeks ahead. And once everyone in Saskatchewan has had a chance to get their first dose, we are immediately going to start with second vaccination doses. We need everyone to go back and get your second dose so that you will be fully vaccinated. I know there are still people who are on the fence about receiving a vaccination, and I would say to them, it's time for you to get off that fence. Every day, across Canada, in this province, and around the world, vaccines are saving people's lives. Countries with high rates of vaccinations are reopening and they're getting back to normal. And at the same time, many countries that have not vaccinated a large number of their population are experiencing a very severe third wave. So if you're on the fence, this should really be one of the easiest decisions that you'll ever make in your life. On one side of that fence, people are living. And on the other side of that fence, people are dying. It's quite simple for all of us. We are so fortunate in Canada and in Saskatchewan to have access to the safe and effective vaccines that we do. And very soon, every one of us is going to have a chance to receive that vaccine. Every one of us can do one simple thing to protect ourselves, to protect the people around you, to protect your family members, and to allow us to get life back to normal in Saskatchewan. I would ask, why on earth would you not do that? The good news is that the overwhelming majority of Saskatchewan people most certainly are making the right choice. They're getting vaccinated when it's their turn. And everyone else is going to have their opportunity very shortly. And when that happens, we can start to ease the restrictions in our communities. We can start to get our lives back to normal. And we can have a great Saskatchewan summer. So for now, let's keep doing what we need to do. Keep following all of the public health orders and the guidelines that are in place. It's incredibly important that we do just that in the weeks ahead. And when it's your turn, it's just as important for you to roll up your sleeve, stick it to COVID, and get vaccinated. Dr. Shahab?
Thank you, Premier. So I'll just first of all start by expressing my sympathies to the family and friends of the 18 Saskatchewan residents who have lost their lives due to COVID over the last week. In terms of the roadmap announcement, I'll just reinforce what the Premier already said, that we must understand that, while we have a 70% vaccination threshold for the reopening plan, it remains our goal to achieve a much higher immunization rate. And I think we need to seek inspiration from our seniors or elders who have a well over 85% vaccination rate. May and June are going to be blockbuster months for vaccine supply. And so, as the Premier said, we are so fortunate in Saskatchewan and Canada to have safe and effective vaccines abundantly available. And how can we not say no to this privilege? It is critical for our own safety and the safety of our friends and family and communities. And it is a fundamental additional layer that will help us come out of this third wave and see a better summer and a better fall. Vaccinations will help us not only enjoy a better summer, but a better fall as well. We must look at the short-term, medium-term, and the long-term benefits of a high vaccination uptake. The roadmap also speaks to a 3-week period at each stage, because we must remember that vaccines take at least 3 weeks after the first dose to mount some immune protection, and that only keeps improving over time, and of course is boosted with that all-important second dose. So while our second doses are delayed, they will be critical to complete our immune response, and again, that is critical for the medium to long term as well, and to not just have a great summer, but to have a as uneventful fall as well. We obviously will continue to monitor all COVID transmission trends as we have on our dashboard: daily case numbers, test positivity, hospitalization rates, and all of that will be used to monitor the situation locally and provincially and keep informing the reopen plan. And that is why the public health measures are going to be so critical now and as required and as adjusted in the future. We must recognize that while the variants were an immense challenge for us in not just Saskatchewan, but throughout Canada, as our vaccination rates were just starting to pick up March, the bulk of the suppression of the variants was through public health measures. It was through all of us, residents of Saskatchewan, being careful, considerate, thoughtful about what they were doing, keeping their contacts low, wearing a mask when in indoor public places and in workplaces. And through those critical individual actions, we were able to reduce the surge in Regina, and we've managed to at least stabilize and see a downward trend throughout Saskatchewan. So this attention to public health measures till such time that the bulk of our population has a higher vaccine uptake, first dose, and then second dose is going to be critical. And as the Premier said, we will be assessing, on a weekly basis, and especially after we achieve step 1 and step 2 and finally step 3, what measures regarding gathering size limits, mask use in indoor public spaces can be safely relaxed. And I would also like to recognize that, we all have our risk thresholds, but we all need to be patient and pull together while we achieve these targets. Thank you very much.
Thank you, Premier Moe and Dr. Shahab. We'll now take questions, and we'll start in the room. Mark?
Experts have suggested that because the variants of concern are more transmissible, that an 80 to 85% threshold for vaccinations should be met before loosening restrictions. How did you guys settle on the 70%?
Well, if you, a couple of things and Dr. Shahab, if you have anything to add, I'm sure you will, but a few things I would just say with respect to the threshold that we have, and it would be my hope that we actually achieve those metrics by the time we start opening, relaxing any of the restrictions that we have. And I would implore on Saskatchewan people to, continue to go out and get vaccinated, and we will ultimately achieve those metrics. All it will do is make a safer a safer society for all of us. And 70% isn't where the vaccination effort will stop. It will go much higher than that, and it has shown that in our upper age groups going well beyond the 80 of access to a vaccine. If you look, by the time we hit 70% of those 40 and over, and then take a 3-week interval to ensure that those vaccines are being effective in those people, that will bring us towards the end of May, at which point everyone in this province will have access to a vaccine by that point in time, which I think is also an important metric. And when you look at phase 1 of the plan, it is it is a very cautious and measured step. It is not a large step towards reopening in any way. The second phase would be a much larger step that will happen sometime in June when we have an even higher vaccination rate than what we do here today. So those are the first few points that I would make. The final point that I would make is this has worked in other jurisdictions. I made notes about when the UK began their reopening at about 43% of the vaccination rate. They also were dealing with the UK virus, thus its name. They moved to phase 2 at about 61% vaccination rate. I'm certain that we will be in that realm, or even maybe beyond that, quite likely beyond that, when we move towards the second phase of the reopening plan here. So it's worked in other jurisdictions, and we firmly believe that it will work here in Saskatchewan. And what we want to do is to provide the metrics for Saskatchewan people so that we know and we trust that Saskatchewan people will strive to meet these metrics. And I just would close with the once again requesting it's more important than ever to ensure that we're doing the two things that matter right now: follow the public health measures, and when it's your turn, take the opportunity to receive one of the vaccines that are available. Dr. Shahab, anything to add?
Yeah, thanks. So I would say any vaccine preventable diseases, and now COVID is thankfully a vaccine preventable disease. We in Saskatchewan have a high vaccination rates, like for measles, mumps, rubella. Our vaccination rates are routinely in the high 80s or even in the 90s. So we have a very strong platform. Again, we launched one of the most successful age sequence vaccination programs during the H1N1 pandemic in 2009. And at that time, we were aiming for a very high vaccination uptake. But once we hit 60%, the pandemic stopped in its tracks in Saskatchewan. Obviously, COVID is not H1N1 influenza. COVID is a much more serious illness. We have to remember that COVID vaccine provides individual protection that we should never forget. We should never assume there's less than 0.1% of people or 0.01% of people who may have a true allergy to some of a constituent of the vaccine, and then they can always be advised another vaccine. Virtually all of us can safely receive any of the vaccines that are available in Saskatchewan. And what that means is that it is critical that for our own individual clinical protection, we get vaccinated. The vaccine has been effective against all strains of COVID so far in Canada, including the variant strains. And even the deaths we announced tragically say that even though, unfortunately, deaths are more common in seniors, and we've seen how dramatically they've reduced hospitalization and deaths in our seniors, we can never underestimate COVID at any age. So that's my first plea, that all of us should get vaccinated. At the moment, under 15-year-olds are not eligible. And so as adults, by getting vaccinated, we protect ourselves, we protect those who cannot still be vaccinated. And secondly, the higher our vaccine uptake is, the better protected we will be, not just in the summer, but well into the fall. So again, while the 70% threshold is a waypoint to show us the way, I would certainly endorse as high a vaccine uptake as we can. And again, I think we should never forget the great privilege we have to be able to get vaccinated with a safe and effective vaccine in Saskatchewan. Thank you.
Follow up, Mark?
You have vaccination levels in each step. Are there case levels, hospitalization levels that you'd like to see us hit before we get to step 1? And if we aren't at those marks, do we delay the reopening at all?
The vaccination levels are going to drive the phases of the reopening, with the 3-week delay from when we achieve that metric until we actually move forward with the reopening. And with those vaccines that are delivered, we'll have the time to be providing that immunity that a vaccine can. And there'll be a number of people that will receive their vaccines in the in-between time there as well. Obviously, we will be, as we always do, watching our hospitalizations, our ICU admissions. We're always keeping an eye on that. This is a plan that we have it set so that we will move with phase 1 3 weeks after we achieve that metric. If we achieve the second metric in that time period, we would still wait those 3 weeks and then move forward with the phase 2, which would be 3 weeks after that. So 3 weeks, 3 weeks, 3 weeks if we continue to meet those particular metrics. It is a plan that can be moved. If we meet those metrics earlier, we could have a conversation at that point in time, but that conversation would most at pulling that start date forward a few days, but that conversation would be very dependent on, ultimately maybe less so daily case rates, more so what's happening in our ICU and hospitalization rates. Dr. Shahab, anything to add to that? I know you're watching those.
Yeah, thanks. So, last time we reopened, we had very low case numbers and no vaccine and no variants. And then, in the fall, when school started, we had low case numbers. Then we had a second wave, mostly with the original strain that we overcame with public health measures. Vaccinations had just started. And then our case numbers were trending towards, lower than that 10 cases per 100,000 mark. And then in Saskatchewan, as well as many other parts of Canada, we have seen a third wave, primarily fueled by variants. And while 70 and older who have been well protected by the vaccine has hit our younger working age adult population extremely hard. So recognizing that, I think obviously we will keep a close eye on transmission numbers and hospitalizations. And we absolutely, as the Premier said, need to practice all our public health measures currently. But, again, jurisdictions have seen that with the robust vaccine uptake, numbers do come down. But it has to be managed. I think one thing we've learned is that we are in this for the long term. COVID is not going away, and there'll be variants throughout the world. We are not safe till the world is vaccinated, and till such time, obviously we will have to keep a close eye on importation of variants, on transmission rates in our communities. We'll especially need to keep understanding what are the settings in which transmission happens. If we have 80% vaccine uptake, which is my hope, 85%, who is unvaccinated? Are there any populations that we need to do specific reach outs to encourage vaccine uptake and address any concerns around hesitancy? All those things will be critical as we move forward.
We'll take another question in the room. Adam?
Just to follow up on Mark's question there, what sorts of numbers, if we see hospitalizations or ICU cases increase, let's say in the short term, May and June, what would that do to this plan? I know you say this is, focused on vaccination rates, but if we have ICUs that are busy in one area of the province, does that cause that area of the province to step back from one of these steps? Or I guess, how does that inform whether the plan gets interrupted or delayed?
So I had a couple of comments, and Dr. Shahab, you'd have likely something to add to this. This would be the first place that would ever occur. What we're seeing in other areas of the world, for example, in Israel, where they are now at 77% of their residents have received their first dose. They led the world in vaccination rates early. The UK, I mentioned, started their reopening at 43%, now at 66%, has continued through their reopening plan without taking any steps back, and we've seen quite the opposite, where hospitalizations have continued to drop in the UK. Even in the US, where we were having a very different conversation around COVID infections just a few months ago, now with 56% of their population receiving the first dose, we see in the United States decreasing hospitalizations as well relative to where they were not that long ago. So that would be not expected as our vaccination levels continue to increase. The expectation would be that our severe outcomes from COVID continue to decrease through that period of time, like they have in other nations around the world. That being said, Dr. Shahab continuously has his eye on, and Scott Livingstone does as well, on the the capacity that we have within our provincial healthcare system, whether it be broader hospitalization beds or our ICU capacity in specific areas, like we've just had the conversation for the last number of weeks in and around Regina with the variants of concern and the pressures that placed here. We've seen that be alleviated to a degree in the last few weeks. But Dr. Shahab, I know you're always watching those numbers, so you'd have some comments on this as well, I'm certain.
Yeah, thanks. So, on the one hand, while we talk about rates and numbers, I think we need to acknowledge that we're talking about individuals who are hospitalized and unfortunately in some cases pass away, and the great distress it causes families, friends, and communities. So, and we must strive through public health measures, through vaccinations, to ensure that we keep our numbers low by keeping ourselves safe and those around us safe. So even if you have someone in your family who's not yet eligible, and you are, by getting vaccinated, you're protecting others in your family right away. And once your immunity kicks in within 2 to 3 weeks, so that's critical. Obviously, case numbers, daily case numbers are leading indicators, which we'll be continue to watch closely. Daily case numbers, test positivity rates, active case rates. We have that on our data dashboard. That will be there. That will always alert us to what is happening in a specific part of the province, because public health will continue to investigate, and through contact tracing and case investigations, try to determine what are the factors that are causing an increase in cases, if that was to happen, and to prevent it right then, not to wait for hospitalizations to pick up. Hospitalizations, as we know, are a lagging indicator. They start rising 1 to 3 weeks later. Obviously, if there's an increase in hospitalizations, we should already know that something is happening in terms of case numbers, but obviously that would be an additional layer of concern. And then, of course, we know that due to hospital stays, there's a tail at which people may be in hospital for a long time before they are discharged from acute care to home, or from ICU to acute care. So all those things have to be watched, but certainly we will not wait to see hospitalizations go up. We will be watching closely if case numbers rise, what are the settings of those transmission, and what are the measures, including public health measures, supporting access and uptake of vaccinations that can be done to address that. As you know, when we had an increase in Regina, additional vaccines were pivoted to Regina, which, along with strict adherence to public health measures, tightening of public health orders in Regina, and individual actions of everyone in Regina made the difference. And so those approaches will continue as we go through the reopening plan.
Follow up, Adam? Follow up, Adam?
What informed this decision today, Premier? I know you talked about the UK. I think we're the first province to lay out a plan like this. So can you just tell me, how long you've been working on this plan, and why you wanted to announce these metrics? Is it to encourage people to go get vaccinated, to try and get that number even higher than 70% as a goal?
Yeah, a number of reasons. The number one reason, I think, is this is a request that we are hearing as representatives across the province. Myself and many other MLAs, they're hearing questions from the people that they represent with respect to we're continuing to follow the public health measures that are in place. Yes, we're going out and getting vaccinated. How does that find us? A level of how does that find us back to some degree of normal in our communities? What this plan does is it's proven to work in other nations, and so we've been watching other nations that have been far ahead of us in their vaccination rates for some period of time, and I've referenced that often. Two, this is a plan that does have a finish line in sight. And it does provide a very clear path on how we can achieve that finish line together in community after community across this province. Follow the public health orders. Go get vaccinated when it's your turn. When we achieve the vaccination rates, we will start to, 3 weeks later, loosen the restrictions that are in place. In that meantime, we can continue to get vaccinated because each of us actually continue to add to not only achieving that 70 percentile metric, but as Dr. Shahab says, going far beyond that. And that is the hope, and that is the belief that I think will occur here, is that we will go far beyond that 70th percentile as a whole adult population, because Saskatchewan people understand very well the responsibility that comes with having the rights that we enjoy in this province.
We'll take another question in the room. Murray?
Why are we not talking about the second dose before we move forward? And why are we not talking about other metrics, particularly on a day when Saskatoon's up to 11% positivity rate, province-wide 7.5% positivity rate? Those numbers aren't looking as good as the things that you can control, which are the vaccine numbers. So I guess why is it good enough to have just one dose before this plan kicks in, and why are we looking at other metrics?
Well, I would, on the one dose and then the other metrics. So first of all, I'll maybe address the other metrics. The other metrics, what we've seen in other jurisdictions are driven by the higher vaccination rates. As we get more people vaccinated, those metrics continue to decrease in other nations, and we would expect that they will here. However, we'll be watching those closely, and I know Dr. Shahab will be watching those very closely as well. On the one dose versus two doses, there's various approaches to this. Israel has used a two-dose approach because they do have access to enough vaccines to provide that. UK, on the other hand, is predominantly one dose, predominantly AstraZeneca vaccine. And in the US, they've also been providing the second dose as quickly as they are able, as they also have access to quite a large number of vaccines, in particular relative to what we have access to here in Canada. So the reason that we are have the metrics around the 16 weeks on between doses here in Canada is simply because we have not, as a nation, procured enough vaccines. So we are offering that first dose to as many people as we possibly can to ensure that we are keeping as many people as safe as we possibly can, and that has proven to be, in the early days, working quite well, in particular not only with our long-term care residents, which do have the second dose, but with our more senior populations, of which I'm almost part of shortly, but that are at highest risk of severe outcomes to COVID. So again, the one dose did work with as a very large success in the UK. We feel it will be successful here. In saying that, we are also being asked by many when they can get their second dose, and I would say, towards the end of May and early June, as we make that first dose of vaccine available to all Saskatchewan residents, we will not take an hour and turn around and start offering that second dose on a priority basis so that people in this province will have their second dose at least within the 16-week time interval that is there. And I would say in many cases it will be far less than that, as our vaccination program is not a flat line at the numbers that we're doing. It's going to increase in the weeks ahead. Dr. Shahab, anything to add on other metrics, one dose versus two dose?
Yeah, obviously, the countries that had access to higher volumes of vaccine, like the US and Israel, went straight with a two-dose program. But the evidence from the UK and other jurisdictions shows that an extended one-dose program is also very good when you have constraints right at the beginning. And I'd like to emphasize that we have reached a certain vaccination level now, almost 4.5 months into the vaccination program. There's going to be 2 blockbuster months to complete first doses, and then and the operational details will come out in more details, but we anticipate that another 2 months, July, August, starting in June, when second doses will start in June, but then in the next 2 months, we will be able to complete the second doses. So the second doses will happen in a much compressed time frame compared to the first dose. And again, I have to emphasize, once eligible, always eligible. It doesn't matter if second doses have started. If for some reason someone didn't get their first dose, they will always be eligible for first doses going forwards and for second doses. So again, I want to emphasize that we are, as long as supplies hold, we are entering a very accelerated phase of completion of first doses for everyone 18 and older, and then completion of second doses in a much more compressed time frame compared to the time frame for completing the first doses. Thank you.
Scott, would you have anything to add on the second dose vaccination program?
I'll follow on to Dr. Shahab's comments about when we're starting. It is true that with moving to the 16-week time period for the second dose for all vaccines, there are a number of individuals who were vaccinated first and did not receive their second vaccine yet that will come eligible in June. But we won't be waiting that 16-week period of time. We'll be backing that up to ensure that we meet that target for everybody, because that was our commitment, and we'll hold that steady and ensure we meet that commitment. But also, as the Premier has said, we will escalate second doses very quickly afterwards, and ensuring that we have people with their second doses well within that 16-week period of time. So not everyone will wait 16 weeks. As we get through that first dose near the end of May, start those second doses for the first individuals that receive their vaccines. We'll be escalating the vaccine program to ensure everyone receives their second dose as soon as possible.
Follow-up, Murray? Follow-up, Murray?
Question. We're just hearing that Alberta is going into lockdown. We have Mother's Day coming up. We have May long weekend where Albertans traditionally come over and open cottages, go camping. Is now not the time to start severely looking at restrictions in relation to Albertans crossing the border here, similar to what was done in Manitoba with the 2-week quarantine period before they go back? And doing so, wouldn't that help the plan? And I guess further to that, would that be Dr. Shahab's recommendation?
Dr. Shahab.
Hi. So first of all, I think, we have all throughout Canada had times when our case numbers have gone up and times when our case numbers have come down. So I think we need to have solidarity with the challenges that our neighbors to the east and west are facing. And we have simply been on the higher side and they've been going down. So we need to make sure that we support each other as Canadians, because essential travel, whether for commercial purposes or cross-border travel for people who live in border communities, or essential travel for personal reasons, to look after an ailing family member. I think those things will continue to happen. But having said that, we've always said throughout this pandemic and that, stay closer to home, even when you're enjoying the summer, if you're going camping or to lakeside, stay closer to home. And similarly, we continue to say, minimize interprovincial travel. And right now, as cases are surging throughout Western Canada, if you do travel, be very mindful of your surroundings that you may not be familiar with, minimize your exposure. Obviously, think of getting vaccinated before you travel. If you're eligible, get tested when you come back at day 0 and day 10 and minimize your contacts on return. All those things are going to be critical. But I think we need to recognize that we have been on the higher side where other provinces neighboring us have been lower. And I think we need to acknowledge that we're all on this together. We all have our unique opportunities and challenges. And I'll just keep it at that. But certainly, there's a lot of travel that happens for work to Northern Alberta, and there's excellent coordination between Northern Saskatchewan and Northern Alberta to minimize transmission risk due to work-related outbreaks on either side. It can be on either side that people are traveling back and forth and could be exposed to COVID, and there has to be ongoing close collaboration on those issues as well.
We'll take our next question.
I agree with Dr. Shahab.
So there's no consideration related to lockdown under the circumstances?
Not at this point. We're looking at, people have been traveling back and forth across not only the Alberta-Saskatchewan border, but the Manitoba-Saskatchewan border as well. And they do so for, multiple reasons. And there has been fluctuations in various provinces, including Saskatchewan, over the course of the last just over a year now. However, I would just ask all that to continue to respect the public health guidance that is in place. That is, you should not be traveling unless it is deemed absolutely necessary. And there's various reasons as to what what necessary travel would be.
We'll take our next question on the line. Operator.
We have Zach Becerra with the Star Phoenix.
Good afternoon, Premier and Dr. Shahab. Thank you for taking our questions today. I know that you're looking at other countries. You've mentioned the United Kingdom and the United States in regards to this reopening plan. But the Public Health Agency of Canada put out some recommendations based on modeling late last month, where they advised to not look at lifting restrictions until about 75% of the population has received their first dose and 20% are fully vaccinated. and they warn that lifting restrictions prematurely could result in yet another wave of COVID-19 in the fall. I'm wondering why you based your decision-making off of what other countries have done rather than what our own public health agency here is recommending.
Well, one, we based our decisions on what has actually worked in other countries versus modeling. What has worked in the UK, what is working throughout the US, large portions of the US, and what has most certainly worked in Israel has been when you are achieving metrics like we have put forward, it is driving down the most severe outcomes due to COVID. I have no doubt if you look at the metrics that we had put forward, and we must understand as well that you know, reopening your economy, your communities is not a light switch that you flick on. You're at full lockdown or some measure of lockdown one day, and the next day you just kick the barn doors open and we're all running out in the field free. That most certainly isn't the way that this works, if it's actually going to work, and it's not the way that for example, the UK has. It's not the path the UK has traveled, which I would say has been working in a large part. Is you rather than flicking that switch, you're turning the lights, and we are going to start that when we achieve the 70% of the people over 40. That will put us at a relatively a much higher rate than they were even in the UK when they began their reopening. When we achieve that 70%, we'll be in likely the mid to high 40s of our entire population. Once the 3-week period has passed, we'll likely be well into the 50 percentiles of people that have received a vaccine, and everyone will be eligible at that point in time before we even move with phase 1, which is not by any stretch a large opening of our communities. But we will have access, everyone in this province will have access to a vaccine before we even take that very first step. Ultimately, I believe by the time we find our way through this plan, and to Dr. Shahab's comments about challenging and asking and Saskatchewan people to go higher than that 70 percentile of our adult population being vaccinated, which I truly believe we will, the 75-20 is likely quite achievable by the time we are finding our ways into phase 2, ultimately into phase 3. We likely are going to achieve those metrics in very short order. As you heard Mr. Scott Livingstone had said, we will waste no time in turning around into our second doses, and our second dose administration is going to happen in much shorter order than it has taken us to administer the first dose, and that will be due just to increased vaccine supply. So those metrics likely will be met as we work our way through this process, but most certainly what we are doing is not so much looking at modeling, but looking at what has worked in other jurisdictions around the world. And we feel it will work very well in Saskatchewan. So, Dr. Shahab, anything to add to that?
Just on the modeling side, I will say that we are obviously in contact with our federal colleagues on their modeling. We also look at modeling within Saskatchewan, and it's not just the modeling; it's also epidemiology and infectious disease epidemiology and how vaccines work. That I would like to reiterate that our job is not done with the first dose. Rapid completion of first doses, as soon as you're eligible, get your first dose, will enable us to have a better summer. But completing your second dose, all of us, will ensure a better fall. So we have to look at the summer. We also have to keep an eye on the fall. And that is why the second doses are critical, not just for the summer, but for a safer COVID-free fall as well. Thank you.
Follow up, Zach?
Yes, thank you. I have another question for the Premier. Premier, one thing I noticed about this plan is that there isn't any differentiation between people who have their first dose of vaccine versus other people in terms of what you can do. The American CDC, for example, I noticed, has different rules for people who are fully vaccinated in terms of mask wearing or indoor gatherings compared to people who have not been vaccinated. And I know that part of your goal here is to incentivize people to go get a vaccine so we can get back to normal. I'm wondering why not have vaccination passports or specific rules for people who have been vaccinated to further incentivize that? What was the thinking there?
The thinking is that we are going to achieve a high enough vaccination rate in this province that that conversation won't even be necessary. And I firmly believe that. That's why we have put forward a plan that ultimately does incentivize Saskatchewan people to go out and get vaccinated. It incentivizes them to ensure they're following the public health orders between now and when we can achieve the phases that are in place. But ultimately, I would again implore on all of us. And I said in my opening comments, if you're on the fence with respect to vaccination, you should not be. They are saving lives around the world, in Canada, and most certainly they're saving lives here in Saskatchewan. There is no reason at all for us to be discussing whether we should or should not be getting a vaccine. We should all be considering when we can ultimately receive that vaccine.
We'll take another question on the line, operator.
We have Lisa Schick with CJME.
Hi. I'm just wondering, why come out with this now? I know you said, Premier, that you wanted to let people know what the plan was, but according to the last health authority presentation to doctors, there's a high likelihood spread is out of control in 2/3 of the areas in the province. So is this really the time to be putting effort into a reopening plan?
Absolutely. This is a time for us to be putting this forward to Saskatchewan people, as it provides them the very clear, concise, and I would say rather simple metrics on how we can find our way using vaccinations and public health measures to find our way through this pandemic. This puts in place what the finish line can potentially look like. It's a proven plan. As I said, it's worked in other areas of the world. There's no reason why it won't be as effective here in Saskatchewan. So we've put this to the people of this province, and let me just say, and Dr. Shahab had said this at the outset, that Saskatchewan people throughout this pandemic have been very careful and considerate, and the vast majority of us have been very respectful throughout this pandemic. We understand the rights that we have in this province, and we also understand the responsibility that we have in preserving those rights and ensuring the safety of ourselves, our family members, our friends, and all of those in our community. So this is the plan that has worked in other areas of the world. We truly believe that it will be effective here in Saskatchewan. We feel it will be more than effective in addressing some of the short-term challenges we have with COVID. We feel it will encourage Saskatchewan people to go out and get vaccinated, drive those vaccination rates up, and as Dr. Shahab had mentioned earlier, that ultimately will provide us in this province the long-term protection that we ultimately want as we return to winter life next fall.
Follow up, Lisa?
Yes, the Regina area have slightly tighter restrictions right now, particularly the travel advisory. Is there any even possibility that those could be changed before step one?
Dr. Shahab, do you want to comment on Regina?
Thank you. So at this point, likely the current public health orders, which are tighter for Regina, but still quite stringent for the rest of the province, will likely continue till the 31st of May. But obviously we will monitor, as I said, on a weekly basis if there can be any relaxation for Regina. As we know, Regina has really turned the corner and is doing really well, but we just need to give it a couple of weeks just for things to stabilize. And obviously we need to keep an eye on Saskatoon, the northwestern parts of the province, because there's some concerning increase. So this is something that will be an ongoing, this will need ongoing caution in terms of making sure that we all are very careful about seeking testing at any sign of symptoms, staying home, and quick case contact tracing. This will remain critical over the next 2 months as our vaccination rates pick up. And then going forwards also, we will have to maintain a high testing rate, because the UK, for example, has some of the highest testing rates in the world. Even though they have very low case numbers, they are still using a high testing rate. And in many cases, they have deployed home testing, which again, Saskatchewan has been a leader in deploying point of care testing through various mechanisms. But the UK, again, has used a high testing rate, both lab-based and home-based, to make sure that even though they're highly vaccinated, their case numbers have come down, their hospitalizations have come down, they are maintaining a high level of vigilance to catch the first sign of a uptake and address that quickly, which is what we will continue to do over the summer and fall, even though our case numbers hopefully will be very low and our vaccination rates will be very high.
We'll take another question on the line, operator.
We have Ryan Kessler with Global.
Good afternoon, and thank you for taking my questions. My first question is, currently we're seeing drive-through lineups for vaccine as high as 6 hours. People are having trouble finding appointments in some cases. How confident are you that there will be enough vaccines available to actually see this plan put into action?
Well, that is one of the variables. I would say there's three variables to this plan. One is if people, for some reason, and I don't expect this, but for some reason, quit following the public health measures. That would threaten the opportunities that we have in this plan. The second variable that we have is that people, for some reason that I wouldn't understand, choose to not go and get vaccinated, and we actually don't achieve the metrics that we had put forward in this plan. That would be a risk to not moving forward with what we have here today. Those are the things that we can control, each of us as individuals in the province. The other item that we have, and we have the capacity to deliver as many vaccines as we receive through the Saskatchewan Health Authority, but the other variable to this plan is ultimately that we don't receive the allotted number of vaccines that we're expecting to receive from the federal government. There's, as I said in my opening remarks, about 360,000 vaccines that we're expecting to receive here in May. To put that in perspective, we've received thus far about 460 or 70,000 thus far all total. So if we receive that many vaccines in May, I have every faith that between our drive-through clinics, our appointment-based system that we have, as well as our pharmaceutical capacity that we have, we'll be able to deliver those vaccines in short order. We'll have the eligibility open up to everyone that ultimately is eligible here in the province, and we'll be looking at how we can then move into second doses ultimately here in Saskatchewan as well. Scott, would you have a little bit more to add maybe on what we foresee with vaccine delivery schedules into the future?
Sure. I think you covered most of it, Premier, but certainly, to Ryan's question, what happens if we don't meet those targets because of vaccine supply? But you've already called out, we are on track to receive a number of vaccines in May. Worst case scenario, if something happened like it has throughout the pandemic, where we've had some small delays, we would have to rebook clinics. But even if we look at our mainstay vaccine, and all four that are available in Canada are safe and effective, but the Pfizer vaccine, where we have been receiving regular shipments, we're due to get over 548,000 doses of Pfizer before the end of June, assuming we don't see any increases, and that's enough doses to get us over the finish line without getting any other doses. But we know we're going to continue to get vaccine. We have the capacity to that. We are seeing long lineups at the drive-thrus because people want to get vaccinated, and that's a good thing. And as we continue to receive more vaccines, we'll open more drive-thrus. The expansion into more community pharmacies will also ease some of that waiting times for individuals, and they'll be able to book across the province in over 350 different pharmacies that are coming on board that are able to deliver vaccine in a very, very high volume. So that, together with the SHA infrastructure for vaccines, is all we have the infrastructure to deliver. What we need now is a stable supply of vaccines, and it looks like we're getting that now in May and June and beyond. So I think we have a lot of confidence in the program with its ability to deliver based on what we're going to need it to do, including the onset of second doses in late May.
Follow up, Ryan?
Yeah, looking at the plan, there's no clear direction on mask use and gathering sizes beyond step 3. Why is that?
We will come to some decisions with respect to the recommendations around mask use and gathering sizes as we make our way through this plan and see the results of the vaccination rates that we intend to drive across this province over the course of the next number of weeks. So those decisions have not been made at this point in time. So you would assume that if nothing does change, those decisions will be made before we get into step 3 of this plan. If they're not made, then it will be status quo for masks for a period of time, and status quo out of step 3 with gathering sizes as well. In saying that, you know, what we've seen in other jurisdictions, as I've mentioned a number of times, is the severe outcomes from COVID, hospitalizations, ICU stays, and ultimate fatalities have dropped and dropped significantly in areas that are achieving the level of vaccination that we are starting to achieve here in Saskatchewan. And so it's our hope that we most certainly, and it's our intent and our belief that we will start seeing the same effects here in the province, and that is good because then we can have this conversation around, you know, what can we have access to in our communities, and that is good because our you know, our opportunities will expand. But I would say that it is of the utmost importance because, as Dr. Shahab had said, when you know, when we talk about statistics in our ICUs or ultimately fatalities, those are Saskatchewan people, and they are a friend and family member of many of us. And there are few families, I think, that have been impacted in the most severe way by extension through a friend or family member over the course of the past year. And that should motivate us, if nothing else, to ensure that we are following the public health orders for the next period of time, and to ensure that when it is our turn, that we are taking that vaccine that is offered to us.
We'll take another question on the line. Operator?
We have Lara Feminoff with 650 CQM.
Hi, thank you so much for taking my call. Premier, in this new plan, have you factored in those who are under the age of 18 and COVID cases amongst that age group, and how that might potentially, an increase in infections in that age group may potentially affect the reopening plan at all?
Right. So if there are some changes made around ages 12 to 15, I believe, with respect to the Pfizer vaccine, there's some discussion. And Dr. Shahab, you likely have more to add on this. But if there's some changes made with respect to that, we ultimately would include that in our percentages and our proportions in this plan. But this plan, like the metrics that were utilized in other countries, is on based on the vaccination rate of those that are eligible to receive the vaccine, and the results speak for themselves in those countries. But any, Dr. Shahab or Scott, any comments on the lower level of our age groups and where that is going with respect to vaccine eligibility?
I'll just maybe initially say, Premier, that you know, Pfizer is licensed for 16 and older, so 16 and 70-year-olds can get the vaccine, so that'll be part of the program. As we go forward, we are expecting approval of at least one vaccine by Health Canada for the 12 to 15 age group, and as soon as that is approved and recommended, we would like to move ahead as quickly as we can for that age group. As we know, young people are independently social, and so the more young people get vaccinated, the lower our community transmission rates will come. Children, 11 and under, of course, are impacted more by vaccination rates in the family, and that's why it's teachers and school staff are already getting vaccinated. If more parents are vaccinated, that will indirectly protect children. But certainly, we'll look forward to over the summer approval of vaccines for children under 11, and of course, we have a strong vaccination program for children, both school-based and otherwise. So as soon as vaccines are approved for children under 11, we would, of course, be very interested in proceeding with vaccinating children as well. But again, like I said before, the higher the vaccination rate of school staff and teachers and parents of children who go to school, the greater the protection is for everyone, including children who currently cannot be vaccinated. Thank you.
Follow up, Laura? Follow up,
Yes.
Laura?
Yes, thank you. We're not expecting, or Canada is not expecting, any significant shipments of the AstraZeneca vaccine anytime soon. So with some people's eligibility for second doses also coming up soon, those who receive the AstraZeneca vaccine, do you expect that there's going to be some mixing of vaccine doses the second time around, and what are your thoughts on that?
I quickly, and then Scott and Dr. Shahab likely both have comments, but I do expect that we will have access to some AstraZeneca in the weeks ahead. I don't know what that is at this point in time, but I would expect that we likely will for second shots at some point. Scott or Dr. Shahab, likely both of you will have comments on that.
Initially, and then Scott. So we will definitely have enough AstraZeneca for second doses as required. Right now, people will not become eligible for second doses till into June. And in terms of mix and match schedules, the UK is actively looking at mix and match schedules, Pfizer, AstraZeneca, and we will await their results by early June, whether there's no difference, whether it's not as effective or more effective, and then that'll inform us for decisions on mix and match schedules if they were to be required. And already in Canada, there was a time, not in Saskatchewan, but in other parts of Canada, where there was some pressure on Moderna supplies, where in a few instances, another mRNA vaccine, Pfizer, was used. It's not, at the moment, it's recommended the second dose should be the same as the first dose, but where required, really, it has been used. At this point, we are confident that there'll be enough second doses of the same product to complete vaccination schedules. But obviously, if there's any need to mix and match schedules, we'll be looking at evidence that's emerging right now on that as well, if required. Scott?
Yep, and just to carry on what Dr. Shahab is saying, we are with the age limits on AstraZeneca, and just to remind folks, our first tranche of AstraZeneca was the large scale drive-through in Regina, where we had over 16,000 people receive their first doses. So we're nowhere near that 16-week window, but because of the age restrictions on AstraZeneca, certainly the next delivery will likely start seeing us look at second doses for those individuals that received the AstraZeneca vaccine. And again, if for some reason we didn't receive it, to Dr. Shahab's point, there will be other options available to individuals, but at this time, we don't have concerns about not receiving it.
We'll take another question on the line. Operator.
We have Julia Peterson with the Canadian Press.
Yes. Hello. My question is primarily for Dr. Shahab. You said that this reopening plan is also important to get immunity in place before fall. So could you discuss some of your concerns about what the fall might be like if we continue to have COVID spread at that time?
So I think, we need to have some humility and recognize our privileged position in the world that, as a province that is well-resourced with lots of space, we have had the luxury of being able to physically distance, to isolate safely, to get treated if required, and now to get vaccinated. The rest of the world, unfortunately, does not have that privilege and will not have that privilege for many, many months. The rest of the world may get vaccinated by the end of 2021 or into 2022. And so obviously, COVID will not end as a global pandemic till that happens. And we need to recognize that international travel is a federal jurisdiction, and screening and quarantine and what will change when people are fully vaccinated is a federal jurisdiction. But we obviously remain extremely interested in monitoring the importation of variants of concern, of variants of interest into Canada and their management, while recognizing that, global travel, global trade is also essential. And while, it has been unprecedented, the limitations on international travel at great economic, personal cost, at some point, those measures will have to be re-looked at in as safe a way as possible. And then for Saskatchewan, for Canada, for the world, COVID is unlikely to just go away. COVID will be with us for many months or years. And we need to learn to live with COVID. We need to learn to be able to confidently reopen. And, like I said, all of us as individuals are on a spectrum. Some can't wait to reopen and have friends and family over. Some may be a bit more cautious and may ask their friends and family that, are you guys vaccinated? Which is fine as well. And some may just want to wait it out a bit. And that's fine. Some may, even if the mask recommendations change, some of us may choose to wear a mask when we are in a crowded indoor setting, and we should acknowledge and respect each other's behaviors and how we all want to keep ourselves individually safe. Or some of us may be living with people who are at higher risk and may not mount as an effective immune response to vaccine. And so we may be doing extra efforts throughout the summer and fall to shield people who may be at increased risk. So, but certainly, I think what we do know at this point is that with the current rates of concern, the higher our vaccine uptake, the less likely we will have cases over the summer and a surge in the fall. The lower our vaccine uptake, even if our case numbers go down to extremely low levels, if we have a low vaccine uptake, our risk of a fall surge is higher. And I think that is a fundamental question. And we are one of the few countries, one of the few provinces in the world who have the privilege to get vaccinated. I think we just have to watch the international news to be humbled and saddened by the lack of access to clinical care, to vaccines in many parts of the world. And I think, as individuals, we need to make sure we get vaccinated to protect ourselves and our family and our communities. But obviously, the job of protecting the world and solidarity internationally is something that is going to take many, many months.
Follow up, Julia?
No, that answers my question. Thank you.
We'll take our last question in the room. Arthur?
Quick clarifying question to start. I think you said that there's 360 vaccines expected over the month of May, but I believe that the federal government shipments only lay out about 280,000. Are there some others that we're not taking into account there? I'm just sort of wondering where that number comes from.
Scott, do you have a clarification on what we're expecting in May? I think I pulled that number out of my initial notes.
I don't have it right in front of me, Premier, but I do know the Pfizer allocations, but certainly we can follow up with Arthur and give him that number immediately after the conference. I'll look for it now.
Do you have a follow-up, Arthur? Yeah.
Follow-up. I just wanted to know what happens if there's low uptake in a certain segment of the population. Like, is there room for flexibility within this plan? Say, if you're not meeting the targets in stage 2, but you're getting a significant uptake with younger people, is there a way of readjusting that?
367,000 in my opening comments, but we'll confirm that with you. Your question is in direct contrast to your colleague's question, Zach's. But the uptake, first of all, we've talked about this as well, concern around the uptake percentages as you move down to the lower age groups, and I won't say that we. That thought hasn't passed our mind as well. But most certainly, I think this is a plan that, in many ways lays out what the criteria is for us to head back to normal in our communities. And that criteria is not criteria that's been, pulled from the sky. It's criteria that has actually worked in other nations, and we expect that it will be very successful here as well. But the vaccination percentages that we will look at are those that are eligible to receive the vaccine overall. What we've seen with a little maybe more directly to your question, what we're seeing in Saskatchewan in our various age groups is some of the highest uptake in the nation. And for that, I'm forever grateful to Saskatchewan people. They have been going out and getting their vaccinations. We saw well over 90% vaccination rate, 2 doses in most cases in our long-term care facilities. We're seeing, I believe we hit 75% in all of those over 50 years old today. So what we're seeing is, very much in contrast to the concerns that were raised in your question. And we're, with this plan now in place, we feel that this will continue to provide that incentive for those Saskatchewan people that have not went out and gotten their first dose, at this point, that they most certainly will. And it will do nothing but save lives. Maybe yours, maybe someone close to you. And so I would encourage everyone to do just that. Dr. Shahab, Scott, you might have something to add to that, because we have discussed this.
On the uptakes, I think it's in the news release today. So 80 plus, 87%, that's the target to follow. Our 85 plus seniors or elders have set the target for the rest of us. 70 to 79, current uptake first dose, 85%, 60 to 69, 78%. But again, once eligible, always eligible. So people in the 60s are still getting vaccinated. 50 to 59% is 63%. So again, people became eligible in this age group, just 2-3 short weeks ago, and are still getting vaccinated. 40 to 49 recently became eligible, already at 39%, and 30 to 39 who will become eligible shortly and already are in terms of fire, police, and teachers at all ages. The vaccination rate is 13%. So we have seen rapid uptake in age groups as they become eligible. And, I must insist that, none of us can underestimate COVID, even if you're young and healthy. We have seen, the damage COVID does at any age group, and the damage that current and future variant strains will pose. So I would really encourage all of us to find the time to get vaccinated. I know many of us have busy lives. We work in jobs, and we may say, I'll wait a bit to get vaccinated. We are all able to go while at work to get vaccinated. It's important that we make a booking as soon as we are eligible and get that vaccine at any age group, and especially for people who work outside the house, who have worked so bravely over the last 14 months, in bars, restaurants, retail. I think all of us should make vaccination a priority as soon as we become eligible. Thank you.
Scott, anything to add to that?
Just to confirm the number of vaccine doses that you've quoted, it is 360,000 plus for May.
Okay, that's
Where those are coming from then, because there were only 280 Moderna and Pfizer.
We can provide you with a
federal
breakdown.
shipments.
Yeah, we'll provide Arthur with a breakdown, Scott, of what we're receiving in May and what kind.
Yep.
Thank you.
Thank you, everyone. That concludes today's availability.